Hello everyone, welcome to AY Tutorials. Today we are going to see alcohol withdrawal symptoms, treatment and timeline. Variability in the severity. The difficulty of resolving depends entirely on the severity of the syndrome. So, in the outpatient department, mild alcohol withdrawal syndrome can be treated using a tampering regimen of either benzodiazepines or gabapentin administered with the assistance of a support person. These regimens it includes the fixed dosing with as needed doses available. Finally, it is paramount to diagnose and address the underlying alcohol withdrawal syndrome, which often involves starting a medication and ensuring the appropriate outpatient follow-up. Mild cases, milder syndromes like anxiety or tremors may resolve on their own within the 48 hours without medical intervention. These are often self-limiting. In milder cases, there are certain symptoms like anxiety and tremors, but they can resolve on their own within some hours. Then, severe cases, the most severe forms, such as withdrawal seizures and delirium treatments, are medical emergencies that require immediate and aggressive treatment, and they have a significant risk of morbidity and mortality. What is alcohol withdrawal syndrome? It is a set of symptoms that occurs when a person who has been drinking heavily and for prolonged periods suddenly reduces or stops their alcohol intake. This alcohol withdrawal syndrome it can develop in individuals who have been consuming large amounts of alcohol over an extended period. When they stop the drinking, their bodies react to the absence of alcohol, which leads to a range of physical and psychological symptoms. And this conditions is particularly common among those with alcohol use disorder, where the body has adapted to the presence of alcohol and becomes dependent on it to function normally. The neurological causes. Chronic alcohol use can change the brain's chemistry. It downregulates the GABAergic receptors, which have a calming effect. It upregulates the glutaminergic receptors, which have an excitatory effect. Means they reduces the action of GABAergic receptors and increases the action of glutaminergic receptors. When alcohol is removed, the CNS remains in the hyperexcitable state, which leads to a physical and psychological symptoms of withdrawal. Then spectrum of symptoms. Alcohol withdrawal syndrome can range from mild discomfort to a life-threatening medical emergencies. Mild symptoms it includes the anxiety, restlessness, insomnia, headaches and tremors. Then moderate symptoms it includes the increase in heart rate, then sweating, nausea and gastrointestinal disturbances. Severe symptoms includes hallucinations, seizures, delirium, tremors, which can be life threatening and require immediate medical attention. Key phases and their difficulty. Initial withdrawal it includes the period of 6 to 8 hours. It is characterized by the symptoms like tremors, anxiety and autonomic hyperactivity. It includes tachycardia and hypertension. These 6 to 12 hours after the last drink, patient is having headaches, then trouble in sleeping, anxiety, shaking, stomach pain, fast heartbeat, then difficulty. Generally, this phase is manageable, but it requires careful monitoring and it prevent the progression. Medical management is crucial for preventing progression from mild to severe symptoms. Then, for managing the dangerous symptoms of the severe withdrawal, these dangerous symptoms it includes the delirium, tremors, seizures. Then, ensuring the patient safety and comfort. Withdrawal seizures in that 48 to 12 to 48 hours. Difficulty. This stage is extremely serious, and seizures can lead to the injury, and their presence indicates a high risk of progressing to the delirium tremors. So immediate medical attention is required, and this stage it requires immediate medical care. Key phases and their difficulty in that delirium tremors, 3 plus days difficulty. This is the most challenging and life threatening stage, and it involves a rapid onset and fluctuating disturbances of attention and cognition and severe autonomic instability, and it requires intensive medical management, often in an ICU setting, to stabilize the patient and to prevent the death. The challenges in resolution: lack of standardized protocols. A major challenge is a wide variation in how alcohol withdrawal syndrome is managed in different healthcare settings, and this can lead to the incorrect dosing of medications and inconsistent care. So, because of lack of standardized protocols, there is the difficulty of cure for the syndrome. Then, diagnosing the alcohol withdrawal syndrome, diagnosing the AWS, that is alcohol withdrawal syndrome. It's a diagnosis of exclusion, and clinicians must be careful to rule out other serious conditions that can mimic the alcohol withdrawal syndrome. Example includes sepsis, traumatic brain injury. The challenges in resolution: the clinical nature. Management relies on a clinical assessment, not just a score. This requires experienced and nuanced judgment from the healthcare providers. Then, patient factors: coexisting medical conditions, polysubstances abuse, and a history of previous severe withdrawal. It all increases the difficulty of resolution of alcohol withdrawal syndrome. Conclusion: resolution is possible. With the proper assessment, monitoring, and evidence based medical management, alcohol withdrawal syndrome can be resolved safely. Difficulty is a spectrum. The difficulty of resolution is directly proportional to the severity of the syndrome. Medical care is essential. While mild cases may resolve on their own, prompt medical intervention is critical for preventing complications and ensuring a safe outcome, especially in moderate to severe cases. This alcohol withdrawal syndrome can be managed with the proper medical attention. If you like this video, please like, share, and subscribe to the AY tutorials. Thank you.